Thanks for listening to the Thyroid Fixer podcast with your host, me, Dr. Amy Horniman, aka the Thyroid Fixer. Also, functional medicine practitioner, hormone and weight loss expert. We're talking all things thyroid, hormone, and health related in order to empower, educate, and transform you. Remember, I fix your thyroid, I fix your hormones, I fix your life. So let's get started. Magnesium. It's imperative for so many different functions of the body, and yet over 50% of us are deficient in magnesium, and that's just the ones that are being tested, and we're actually seeing the deficiency. Most people just walk around daily and don't even take it. Magnesium is important for muscle and nerve function, for your heart to beat regularly, blood pressure regulation, blood sugar management, maintenance of energy levels, T4 to T3 conversion, inflammation, sleep, mood. I mean, why are we not taking this on a daily basis? Why? This should be standard. This should be standard in every single one of your protocols, and you should be taking it every single day. But, you know, there's a lot of mags out there. There's a lot of good ones. There's a lot of bad ones. Sure, you can walk down to Costco. You can walk down to Walmart and grab a magnesium off the shelf. And it's probably magnesium citrate, which isn't bad, but it's going to help you poop. There's so many different forms of magnesium that you need to really be an educated consumer, especially if you have hypothyroidism, to know what forms of magnesium to get and what to look for on that label. So let's first go over what it's good for and really what you want to look for as a thyroid patient. So this is going to be a game changer for you, and you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixer line is Metabolism Fixer. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixer. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract, we have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixer or Metabolism Fixer. But Metabolism Fixer, ooh, yeah, we kicked it up a notch. It is in powder form, so you can drink it through your day. It's going to flavor your water. We got orange crush and refreshing citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixer today. Please let me know how you do on it. I am super excited for you. Super excited. So we went over everything that magnesium does. And we know, listen, if you have Hashimoto's, it's an autoimmune condition. You're going to have inflammation in your body. You are going to struggle converting T4 to T3. You know, the analogy I love to use is that of a tired woman. You've already, many of you are like, that's me. You've already done your whole day, right? You've worked, you've cleaned, you did all the things for the kids. You finally sit down to watch Firefly Lane on Netflix, and somebody comes in and is like, honey, could you just do one more thing for me? And you're like, you've got to be kidding me. And the answer is no. And that is literally your body dealing with an autoimmune condition, dealing with Hashimoto's. And then you're asking it to please convert this inactive thyroid hormone T4 into the active thyroid hormone T3. And it just gives you the bird. And it basically says, no, I'm not going to do it unless it has some help. And that's where all the inflammation comes in with autoimmunity and with Hashimoto's. So let's give it some help. One form of magnesium I want to talk about, magnesium oxide. We actually can see that it increases thyroid hormone production and reduces inflammation. So what we're going to see with mag oxide, your body's going to manufacture more T4. Now, we don't want necessarily a ton of T4, right? Because we don't want you overburdened with too much T4, and then all of a sudden you can't even convert that T4 to T3. But we want that normal amount of T4 that your thyroid gland would naturally produce. So we want that normal production of T4. And then we want help converting T4 to T3. We want help with constipation and digestion because many of you are very constipated because of that slowed gastric motility from being hypo, low, and slow. And then we need sleep. Many of you struggle with sleep, especially if you have hypothyroidism or hormone imbalance. We want that sleep, and we want a deep quality of sleep in order to heal. And that in turn is going to come back around and reduce inflammation, which is going to help that T4 to T3 conversion. You can see how it's all tied together. We want to reduce your muscle aches from being all tense and tight. I want you to relax at night. I want you to have improved feelings of calm, because we know with hypothyroidism, we can get either anxiety or depression that isn't tied to hyper or hypo. It's not like if you're hyper, you're going to be anxious. If you're hypo, you're going to be depressed. No, you can be anxious and depressed and swing back and forth between the two if you're hypo. We want reduced blood pressure. We want a good blood pressure. So your BP might be high or low, but magnesium is going to come in and help with that. And it's going to help with the heart palpitations that you may experience when you are finally put on the right thyroid medication. Maybe you're put on T3 and, oh my gosh, finally somebody is listening to me. I'm feeling a little bit better, but I'm getting a little bit of heart palps. Bring in the mag. So I started talking about magnesium oxide. Magnesium oxide is actually the least absorbable form. It's poorly absorbed by the digestive tract. However, and this is why we want to look for combo mags. However, it does help with heartburn. Many of you suffer from heartburn, from low betaine HCl, indigestion, constipation, treatment of migraines. Hello, many of you suffer with migraines as well. And improvement in that T4 to T3 conversion. So oxide, mag oxide is one that we definitely want to add in, because one study did show that 10 weeks of supplementation with mag oxide increased that thyroid hormone production, reduced inflammation, and improved the conversion of T4 to T3. But you don't really want to stop there. You don't just want to stop at one type of magnesium, because many different mags do different things. And we want that beautiful combination. So next up is mag glycinate. So this is usually the most commonly recommended form of mag for hypothyroid patients, because it's the most easily absorbed and it doesn't cause the loose stools. Now, some of you will welcome some loose stools if you are constipated, but you don't want to be taking a mag and having all kinds of bloat belly and switching back from diarrhea to constipation. You don't want that. You want nice and easy, normal bowel movements. Mag glycinate is easily absorbed. And when we look at the action of mag glycinate, that's what's coming in to help with your sleep, your mood, and your blood sugar, which is fascinating because many of you have blood sugar issues. We talk about this all the time. blood sugar issues. And then we normally add on berberine if you're insulin resistant, because we see insulin resistance go hand in hand with hypothyroidism. So we'll bring on the berberine to balance out that insulin and blood sugar. Now you're adding on magnesium and getting an extra benefit of that. So if you are insulin resistant, if you are type 2 diabetic, if you are hypothyroid and you are not on a magnesium, you are silly. That's just silliness. And you better listen up, keep listening to the podcast, and then get on one. So the magnesium helps with anxiety, depression, stress, and insomnia because it is so easily absorbed. And although it doesn't cross the blood-brain barrier, it does very much bring on that feeling of calm. And you can feel it when you take it, especially if you are mag deficient and you take a blend that has magnesium in it and you take it at night before bed, you will feel that feeling of calm and relaxation come on. And sometimes that's enough. Now, some of you are still stacking it with melatonin. That's fine. Some of you are stacking with progesterone. That's fine. But you can't skip the mag. You cannot skip the mag. Now we're going to move on to magnesium malate. Magnesium malate has, oh my goodness, a ton of its own benefits. And the malic acid that the magnesium is bound to has benefits of its own. So with malic acid, we'll see an increase in energy levels, improved athletic performance, skin health is boosted. But when we're looking at malate in and of itself, this is an essential mag for the production of energy in the body. And this also helps mood. So now we have two different magnesiums coming in for mood, for calm. Magnesium malate comes in and works to boost the mood and really improve depression symptoms because it's a required coenzyme to convert tryptophan to serotonin. Now, remember, serotonin is that happy neurotransmitter. So magnesium helps to increase our natural serotonin production. So you don't need the Band-Aids of the antidepressants and the SSRIs, which are what? Select serotonin reuptake inhibitors. So it's all about serotonin. It's all about that happy neurotransmitter, but let's do it naturally instead of Band-Aiding it. Let's add in some mag malate and you're going to see that mood lift. Now, this is over time. This is not like a quick fix. This isn't taking a mood enhancer. This isn't taking an antidepressant where it's wham, bam, thank you, ma'am. This is happening over time as that coenzyme comes in and starts converting tryptophan to serotonin. Now, it's also supporting muscle and nerve function. And I mentioned that earlier. Many of you have joint pain, muscle pain, and some neuropathy. And yes, we can tie that back to hypothyroidism. When I'm talking about the symptoms of hypothyroidism, the list is long. There are a ton of symptoms associated with hypothyroidism because the thyroid is the master gland. Many of them are connected to a neurological musculoskeletal condition. So you might get the label of fibromyalgia, but it really is your thyroid's not optimized. You might get the label of diabetic neuropathy. And hey, if you have uncontrolled diabetes, maybe it is. Or maybe it's non-optimized thyroid. So this is one thing that we can bring in that will not only, as we said earlier, help with thyroid hormone production, help with conversion of T4 to T3, help with ATP production. Now we have malate coming in, supporting muscle and nerve function. So it might actually help improve muscle and nerve function, help those muscles to relax, help reduce muscle cramps, help with pain. And then on top of that, we're also improving the brain and nerves transmission because we know that low levels of magnesium impacts the risk of neurological disorders. And myself, coming from my mom and my grandma that had Alzheimer's. I am doing all the things, controlling my blood sugar, which Mag helps with. I am taking my magnesium every day, 100%. I'm taking my hormones. I'm keeping my diet in check, all the things, because that's the last thing that I want. And I know that's the last thing that you want. With athletic performance, this is where the malic acid comes back in with mag malate. When magnesium was studied, it actually enhances exercise performance because it enhances glucose availability in the brain, muscles, and the blood. So it's boosting muscle use, grip strength, lower leg power, jumping performance, which is really fascinating when you look at how magnesium is just such a simple, overlooked mineral that many of us don't take, which is why over half of us are deficient that we know of. And it's something so simple that we can add in to see significant improvements in a multitude of areas of our body. This is the one mineral. Now, again, there's so many different forms of it. We have to look at the forms, but this is the one mineral that I just scratch my head and I go, outside of iodine, I've talked about the importance of iodine. Why are we not all taking this? I mean, kids, young people, adult, all ages, why are we not taking this? It does too many things. So I talked about fibromyalgia, chronic fatigue. Many of you have had that diagnosis, that label put on you alongside your hypothyroidism, or you had that label and maybe it really is hypothyroidism. But mag malate comes in and helps with that. So studies have shown that mag deficiency hugely associated with muscle pain and fatigue and the onset of fibromyalgia and CFS. So there's absolutely a correlation. It's also, we're going to tie this back to the neurotransmitters and the brain. You have a higher pain perception when you are magnesium deficient. How about that? So you have a higher pain perception. So you will have a higher pain threshold with adequate mag. You have a lower pain threshold with magnesium deficiency. So you will perceive pain 10 times more with a mag deficiency than you will if you are not deficient and you're balanced. And again, we have that tie-in to migraines. Now, there's a neurological tie-in. There's that nerve transmission tie-in. There's the relaxation of muscles, pinching on the nerve, tie-in to migraines. But there's also the pain perception tie into migraines. Heart rhythm. I know this from a very personal standpoint. So I shared with you that someone very near and dear to me recently landed in the hospital with ventricular tachycardia. Heart rate going, it looked like a lie detector test. It looked like a child scribbled on a piece of paper. And for those of you who don't know, your heart rate should not look like a child scribbled on a piece of paper. When you watch the movies and they got them on beep, beat, it's a nice steady, right? Just like your heart beats, that's what you see on the monitor. You don't see up, down, up, down, up, down. What did they give them? Bag of mag, a bag of magnesium. Now, yeah, they gave them metropolol and all that to calm the heart rate, but bag of magnesium, because magnesium helps to support heart health and heart rhythm. So it actually lowers your risk of heart disease, lowers your risk of cardiovascular risk, including metabolic syndrome, diabetes, hypertension, and is used to normalize the heartbeat. It's bad without mag. It's really, really bad. And sometimes a magnesium deficiency in and of itself, alongside, let's say, a minor dehydration point, is enough to throw your heart into an AFib or a VTAC situation. Helping with blood sugar regulation. We talked about that earlier. Why not stack on one more thing to help with blood sugar regulation? Why not? All right, we're moving on to mag citrate. This is the one that I joke about. Mag citrate, it helps you poop. because that's what you're given when you do a colonoscopy. That's what you buy at the grocery store or at the drugstore, or that's where your mom said you go buy a bottle of magnesium, honey, because Johnny has to poop. You buy magnesium citrate. But there are other benefits to mag citrate. Actually, some studies have shown that mag citrate can actually help you lose weight. Now, this is going to be through getting into a deeper quality of sleep, improving your sleep and the overall quality, which of course leads to weight loss, leads to better blood sugar regulation, leads to improved insulin tolerance. And then if you're constipated, obviously you're going to be carrying on some more pounds because you got all that inside of you. The T4 to T3 conversion, that's going to improve weight because you're getting more of that active thyroid hormone. You're converting. You're not sitting around with high reverse T3, which is just going to put your body in a shutdown mode. You're actually converting to that active thyroid hormone form. And that in turn is going to improve your overall metabolism. Reversing insulin resistance, we talked about that. If you are insulin resistant, your body cannot tap into its own fat stores for fuel. So we need you stacking as many things, berberine, magnesium, to improve that insulin resistance, 100%. So mag citrate comes in, it has its benefits of its own. It improves ATP production. Without ATP, you got no energy. I talk about ATP a lot when I talk about thyroid fixer and T2. So we need that ATP to have energy, to burn fat, to be a metabolically efficient mitochondria powerhouse. So you can see where mag does so many different things. Like I said, I do recommend taking it at night before bed. And we're going to dive a little bit deeper, so don't turn it off yet. Take it at night before bed. And a big question that comes up is about when to take it in relation to your thyroid medication. So let's say you want to throw some mag in during the day because you want that chill feeling, and that's fine. You can multi-dose magnesium. You can take it during the day. You can take it at night to improve sleep, but you want to take it 1 hour away from your thyroid medication. Now, you will find some publications that say to take it 4 hours away. I haven't found enough evidence to show that it is that impeding of thyroid hormone being absorbed. It's not like an iron, where we know if you take iron close to your thyroid hormone medication, you may impair absorption of it. If you eat or drink coffee near your thyroid medication, there's a good probability that you're going to reduce the absorption. I haven't found anything definitive on magnesium needing to be 4 hours away. So if you do need to take it during the day, just space it out 1 hour away from your thyroid medication. And then if you're taking it at night, you should be totally fine. Unless you're on T4 only and you're taking your T4 at night before bed to improve all things. I mean, ultimately, I would just like you to not be on T4 only and to work with someone who knows what the hell they're doing. They could put you on some T2, T3. You can get T2 over the counter. You put in thyroid fixer, it's going to help, but they will put you on some T3. But if you're not and you're stuck on T4, then you might be taking it before bed. That's fine. Keep that right before your head hits the pillow and bring your mag and your progesterone, bring that on back to an hour before bed. Even your melatonin, an hour before bed. That's still going to help with sleep. Now, I want to talk about Aquamin, which is a form of magnesium with high mineral content. And this is what I put in my quad mag by the Fixer. So in the quad mag, I have citrate, mag oxide, mag malate, mag glycinate. So 4 different types of magnesium are in my quad mag, the 4 that we just talked about. And Aquamin, which is a unique multi-mineral complex that I just think it's so cool. It's just, I love this because we're all so deficient in trace minerals, so deficient. And it's really hard to get unless you take a separate trace mineral supplement. And now, you're like, I got too many supplements here. I don't know what to take. I don't know what they do. So Aquaman is actually in my Quad Mag, unique multi-mineral complex powder. And it's actually extracted from the cell wall of red marine algae harvested from cold Atlantic waters off the northwest and southwest coast of Ireland. So you're getting some Ireland minerals. And the benefits of Aquaman, there are 33 peer-reviewed publications over the past decade supporting its unique health-promoting abilities because it is easily absorbed. And those trace minerals give those 4 magnesiums that already have a ton of benefits, take it to the next level. It takes those mags to the next level. So bone health, Aquaman has been shown to reduce pain, improve mobility, and stiffness associated with bone health concerns. And it actually inhibits inflammatory cytokines and COX-2 activity in a dose-dependent manner. So what they found was by giving Aquaman magnesium, the form of magnesium that is Aquaman, and all the trace minerals associated with it, that 70 different subjects with moderate to severe knee pain, 70 different subjects with moderate to severe knee pain were randomly selected to one of 4 12-week groups. So one got glucosamine. We all heard about that, right? One got glucosamine plus Aquaman. The other one just got Aquaman, and one got placebo. The Aquaman alone outperformed the other 3 groups, even the glucosamine with the Aquaman. The Aquaman alone outperformed the other 3 groups, with subject symptoms improving significantly with a reduction in painkiller use by 50%. That is huge. So now you have the benefits that we talked about of all the different mags on pain and muscle and joint and neuropathy, pain perception, migraines. And now you have Aquaman coming in with its trace minerals, just kicking it up a notch. Gastrointestinal health. So that high mineral content in Aquaman can help reduce chronic inflammation in the GI tract because it has anti-inflammatory properties shown to reduce inflammation in the stomach wall and rebuild that leaky gut. So you have leaky gut because of various lipopolysaccharides, LPS. They're the bad guys. Think gluten, think pesticides, toxins. They come in and they chip away at the sides of your intestine, which should really be solid, an enclosed component, an enclosed system from your mouth to your bum. Well, what we have found that occurs in leaky gut are these permeable bad guys chip their way through the gut lining, and then bad things can actually get into the system and go systemic. So that's where you get that full body inflammation, that full body inflammatory response from leaky gut. That's where we see more autoimmune conditions come on from people with leaky gut. That's one of the legs of the 3-legged stool of autoimmune, is having leaky gut, because that triggers autoimmune reactions. It triggers autoimmune conditions. That could be alone what flipped the switch for your Hashimoto's to say hello. So we want to improve our gut wall, and that could be a separate podcast in and of itself. Improve our gut wall, improve our gut lining, reduce inflammation in the GI tract for an overall healthier gut. We also see the benefits of Aquaman in hydration and improving hydration, sport performance, a reduction in colon polyps, which is very, very interesting. So the benefits of using Aquaman go far beyond even the benefits of magnesium. So you combine these two and you really can't go wrong. So the bottom line is this. If you want a good mag, there are a few companies out there that have really good magnesiums. Of course, I'm privy to mine, the Quad Mag. Bioptimizers has Magnesium Breakthrough. That's very, very good. I no longer recommend single mags I think you really, when you look at the studies and everything that we went over today, you really have to be picky and get a magnesium that is multi-complex, that has more than one mag. Because again, who wants to take a bunch of different magnesiums? That gets old. And I want you to take high quality magnesiums, not ones that you can get at Vitacost, not ones that you can get at Costco or the drugstore. I want you to get a high quality magnesium, and you're probably going to have to order that online. So we'll put, obviously, the link to Quad Mag in the show notes. You can grab that bad boy with the Aquaman. But just, I want you to absorb, no pun intended, absorb everything that we talked about today and make sure that you are taking a magnesium, not off Amazon, a good high quality multi magnesium to get all of the benefits. And you will start to see the benefits stack up one upon another. You're going to get better sleep. You're going to be pooping every day. You're going to be more relaxed. You're going to be in a better mood. Your headaches will decrease. Your heart palpitations will go down. You need magnesium if you're going to go up in your T3, because if you get those heart palps, that's going to stop you in your tracks from going up in your dose. You need magnesium. Please add it in if you're a human being, and especially if you're a human being with hypothyroidism. Hey guys, thank you so much for listening to the podcast. I hope you loved it. And as always, if you would be so kind to leave a review if you are listening on Apple Podcasts, that would be absolutely amazing. I read all of them. Also, anything that you hear on this podcast is not intended to diagnose or treat any kind of medical condition. So we always recommend that you check with your medical provider, your doctor, your nurse practitioner before implementing anything that you hear on this podcast. And if you want to find out more about working together, you can click the link below in the show notes to book a discovery call. And there you'll be talking to a member of my team. They are an extension of me. They are amazing. And you and I will talk after that once we get you all signed up and you and I get to work together. All right. I hope to see you soon.